As I approach this case, the first thing I notice on these unenhanced CT images is the preservation of cerebral volume, indicating that this is likely a younger adult. What grabs my attention next is the high attenuation material in the prepontine cistern, extending anteriorly to the cavernous sinuses. This finding strongly suggests acute subarachnoid hemorrhage, which is further supported by the prominence of the lateral ventricles, hinting at early hydrocephalus. The absence of additional hemorrhage or trauma-related fractures, such as a calvarial fracture, is a key negative finding here, narrowing down the potential causes. Given the imaging and the clinical context of a young adult, my primary diagnosis would be a spontaneous subarachnoid hemorrhage, possibly secondary to a ruptured aneurysm, though no clear cause is identified on this particular CT. While a subarachnoid hemorrhage could also result from trauma, the lack of external injury signs makes this less likely in this case. I would immediately consider further imaging, specifically a CT angiogram, to look for an aneurysmal source or any other vascular malformation. This is crucial because identifying the source of the hemorrhage could directly impact the urgency and type of intervention required. If a clear source is still not identified, I might discuss the need for a digital subtraction angiography, DSA, or even a lumbar puncture if clinical suspicion remains high. In terms of management, this patient would need to be closely monitored for signs of increasing intracranial pressure, with a neurosurgical consultation urgently sought. If an aneurysm is identified, securing it via endovascular coiling or surgical clipping would be the next step. Now, considering potential follow-up questions, the examiner might ask, 1. What other imaging findings might you look for in cases of subarachnoid hemorrhage? I would emphasize the importance of scrutinizing the basal cisterns, sylvian fissures, and the third ventricle for hyperdensity. I would also pay close attention to the foramen magnum for signs of tonsillar herniation, which might suggest raised intracranial pressure. 2. What are the potential complications of untreated subarachnoid hemorrhage? Untreated, this condition could lead to devastating complications like rebleeding, hydrocephalus, vasospasm leading to ischemic stroke, or even death. Therefore, timely diagnosis and intervention are critical. 3. If no aneurysm is identified, what would be your next steps? In the absence of an identifiable aneurysm, I would still consider a lumbar puncture to confirm the presence of xanthochromia, indicating blood in the CSF. Additionally, follow-up imaging might be necessary, as small aneurysms or vascular malformations can sometimes be missed on initial studies.